Well, we saw the Senate pass a budget on Wednesday, and with us today are our two principals to talk about it. Uh, Let me get your reaction, Ms. Wohlgemuth, to what transpired in the Senate on Wednesday.
Well, it was all very interesting, wasn't it? They changed the rules just a little bit in order to get that bill to conference committee. They are reaching the end of the session, as you are well aware. It's over at the end of May, and the emphasis was to try to get it to conference committee so that the differences could be worked out and they could complete their work this session.
Are you pleased with what they passed?
I'm pleased that they're progressing. I prefer the House bill number. I believe that the House bill better reflects the desires of Texans for the legislature to build a budget within the available revenue.
Judge McCown?
Well, the Senate budget's a better budget than the House budget, and I prefer the Senate budget. And as the process moves along, I hope Texans will speak up and make clear that they do too. I think what's important for your viewers to know is that both budgets are very tough budgets for the next 2 years, dramatically underfunding public education and higher education and health and human services.
You disagree?
I agree that these are tough times and that these are tough choices, but I believe that the people have spoken very clearly that they expect this legislature to live within the available revenue and to not raise taxes.
Isn't that what the voters said in the last election, that they wanted a smaller government in Texas, and isn't this what we're getting? And isn't that the will of the people?
I don't think so. I think what the voters were reacting to in the last election were national issues and the federal budget and federal spending. I don't think voters sent any message that they were unhappy with our historically very conservative Texas government. We're already one of the lowest spending states in the country. Now, it is true that when you look at polls, the public says that they prefer cuts, but when you ask them specifically about public education, 80% said they want no cuts. And yet the House budget underfunds public education by almost $9 billion and the Senate budget by almost $5 billion. They say they want no cuts to higher education. Both budgets take out roughly $1 billion from higher education and 20% underfund it. And so I think if anybody thinks that these budgets are what the people wanted, they've misunderstood what the people said.
But I disagree that that's what the people have said, because only 4% of the people that were surveyed in a Texas Tribune, University of Texas poll at the end of February said that they expected this budget to be done with no cuts. And so the people clearly are expecting to have cuts. Everyone has a different opinion about what those should be. And so I think that's where you see the difference in the polls. The Texas families are having to make some tough choices, and so I believe that the legislature is expected to do no less.
Senate has cut reimbursements to Medicaid providers by 6% during a time of prices going up on everything. Isn't that going to hurt the health care of many families in Texas?
Well, let's look back at what caused that. The Medicaid has been increasing tremendously over the last 2 decades, just a rate of growth that is unsustainable, and our research at the foundation shows that it's going to truly be unsustainable by next legislative session. So we have this growth projection that is out there. The program is failing, yet the administration in Washington, the current administration, put such barriers to making any kind of fundamental change on that program that the only place the legislature could go was to make provider cuts. We need to re-examine that entire program, which is what we have been advocating is fundamental Medicaid reform. Our research shows that Medicaid is going to consume 46% of the budget next session, and I don't believe that's the priority that Texans would have for the way that we spend our money.
Robert,
instead, we need to take a look at a way to help the people in a way that's also fair to the Texas taxpayer. But we believe that there's ways to do it, that there's enough money in the system, it's just being so inefficiently spent.
Robert, this is an important difference that Arlene and I talk about with each other all the time. We don't have a Medicaid problem. We have a rising cost of health care problem. And in fact, both Medicare and Medicaid rise slower than private health insurance. So the problem is not these programs, it's the fact that healthcare costs go up so fast. That's the problem that our country has to tackle. And in both Washington and in Austin, there are innovative programs that are attempting to get ahead of that cost curve so that the cost of health care can become affordable. And when people say it isn't sustainable to pay for health care, they're basically saying we're not going to pay for health care. It's not that they're offering a better way to do it, they simply want not to do it.
Oh, contraire.
And that's the problem.
Contraire. We have put out a study in February of this year where we demonstrate that we can cover everybody in Texas up to 175% of poverty instead of just those who are currently eligible for Medicaid within the money that was spent in 08-09. So we can cover more people for less, but it's the way that we cover them. And ultimately, it's a question of who decides. Are we going to have a Washington bureaucracy deciding about our health care, or are we going to have Texans deciding about their health care? You know, we're the best ones to control the cost. When we have to pay for something, we make those value decisions. We do it in every other sector of our economy except for health care and mostly for education as well. It's who decides, and I think Texans need to decide.
Well, and in fact, I think what we've seen is, particularly with the Medicare program, that public programs that use private providers are the better way to go, and that an insurance company is itself a bureaucracy that adds a profit layer that then becomes its own problem. And I think the studies that Arlene have done, when she says we can cover everybody, she's talking about covering people for a lot less, so that your benefits aren't there and they're not paying for the same sorts of things. And if I could come back to one other comment, Robert, when we went into this session, everybody expected cuts. There wasn't any doubt that we were going to have cuts. The question is, are we going to take a cuts-only approach, or are we going to take a balanced approach? Arlene's on the side of cuts only. I'm on the side of a balanced approach. We want the legislature to use a substantial part of the rainy day fund, which is going to have at least $9.4 billion in it, if not $12 billion, if left untouched. And that money, already paid in, could go a long way toward minimizing these cuts. In addition, as you know, the Senate took a hard look at non-tax revenue. There's going to be a little non-tax revenue on the table. There could have been more. And we think, frankly, that Texas needs to fix its tax system, and we're going to have to pay more in order to invest in the kinds of things we need to ensure that we're a prosperous state and that we can take care of people.
We're in the middle of this great recession, and people say it's raining right now. Why not use some of that money that's saved?
Well, even Mr. McCown's counterpart in Washington, the Center for Budget Priorities, their ally in Washington, recommended in an article on stateline.org yesterday that states should be keeping 15% of their budget in their rainy day fund. So in Texas, that would be about $12 billion, which is more than we even have in our rainy day fund. Our position is that rainy day fund should be spent as it was, or as it is being considered in this legislative session, to cover a deficit of the current biennium. That's what the voters voted for when they authorized this economic stabilization fund, not to bolster an unsustainable budget for the future. And we need to save that rainy day fund for any shortfalls that come about. For example, we're entering into hurricane season, and because of all the fires that we've had in Texas, our disaster fund is almost depleted. So are we going to spend our rainy day fund now and have absolutely nothing should the state be hit with a bad hurricane? That economic stabilization fund is just that. It's to stabilize and to spend on current deficits. It's not to artificially spend or spend money on an artificially high budget that is not within the available revenue for the next biennium.